I'm Jimmy.
And I'm Logan. Like Cassie said, we're RPAP students, so that means we're in our third year of medical school. We did our first 2 years of medical school at University of Minnesota, Duluth. And then for the third year, we have the option of either going down to the Twin Cities, which I wanted to avoid, so I chose to come to a rural site.
So topic is alternative medicine. We'll talk about some supplementation, probiotics, and hopefully answer some questions. So I'll let Logan more thoroughly introduce himself.
So my name is Logan Smestad. I'm a third-year medical student, as I said before, and I'm originally from Nerstrand, Minnesota. So that's about an hour and a half south of the cities, near Northfield, if you guys know where that is. I went to Gustavus Adolphus College, and I had a biology major and a coaching minor. And then I started at Duluth in 2016 and plan on graduating in 2020. I'm interested in family medicine, so most of my rotations next year will be focused on primary care and family medicine. And both my wife and I really like to be outside and kind of do anything outside. So,
I'm Jimmy. I'm from Deer River. Graduated from Deer River High School, so I'm back close to home, hanging out with family and friends as I'm doing my third year of med school here. I started my college career at ICC, got my associates there. Then went to the College of St. Scholastica for my bachelor's in biochemistry, minor in theology. Now I'm a MD candidate like Logan, hopefully graduating next year. I'm interested in primary care and academic medicine. I keep active with a variety of outdoor sports, and I like playing and writing music, so, and traveling when I can, less so recently, but, so, we have no disclosures really for you all. We're not selling any vitamins or probiotics, no funny business, and none of this is medical advice because we're not doctors. So, and you know, another disclosure is that the field of alternative medicine is very vast, and there's supplements and vitamins that I don't even know the names of and haven't heard of. So we're giving you a small look at a lot of food for thought, and hopefully this is just gets you thinking about what we're interested in when it comes to alternative medicine. So something that'll be relevant throughout our talk is the definition of the RDA, or the recommended daily allowance of vitamins. This is the percentage you see on food labels that all the products that you buy in the store. You'll notice that they're all percentage based. You can look up the actual quantity in grams and micrograms that all that percentage stands for. And this has been established since about the 1940s. It was something that a group known as the NRC came together to produce in the 1940s, mostly just for recommendations for the active military recruits at the time, kids in school. And as you can see here, it was to serve as a goal for good nutrition and as a yardstick by which to measure progress toward that goal. So it was data that's compiled, and it's a recommendation, and it's revised about every 10 years. They come together and make sure that those recommendations are still up to date, and they also define like what the upper limits of a vitamin intake should be, where you start to see toxicities, and what the lowest intakes that you should have. But the percentages are just based on averages. So another thing that will be relevant is what the FDA recommends around food or supplementation. So the FDA is the Food and Drug Administration. They think about supplements and vitamins very differently than they do prescription drugs. Prescription drugs are regulated through the FDA, go through clinical trials. They're meant to treat specific diseases, and they can say that on their labels. Supplements and vitamins, things that are in that category, cannot say that on their labels. They can't say that they treat specific diseases. And that's why on your vitamins and supplements that you buy at the pharmacy or other stores do not say that they treat specific things. But the FDA, however, does have this on their website regarding supplements. The FDA is responsible for taking action against any adulterated or misbranded dietary supplement product after it reaches the market. So that means that if they find that maybe a prescription drug is slipped into a supplement, they can go after the company that released that after it hits the market. But all of the safety regulations that take place for over-the-counter supplements is done by the specific company that releases that supplement. There's no federal regulations that surround it, as there is with prescription drugs. So that'll get us into our first supplement of discussion, and the one that I wanted to touch on was vitamin D, because of all of the supplements and vitamins that you see in the store that you can buy over the counter, this is one of the few vitamins that, if you look it up in the medical literature or physician guidelines for when to give out certain drugs, this is one of the few that has an indication that is more than just vitamin deficiency. So if somebody presents to the physician's office with obvious signs of a vitamin deficiency, and whatever vitamin it might be, things that we're trained to look for, that is the indication to give them that vitamin. And usually that's the only indication. But vitamin D is a little bit different because, as I said, vitamin D deficiency is an indication to give a patient vitamin D, but it is also something that can be given to breastfed infants. And they have a lot of studies that show that is a good time to give vitamin D, is breastfed infants. They also have inadequate intake or exposure, kind of goes in the same category as deficiency, but if you are someone that you know gets minimum amount of sun exposure and it's not found in your foods, that would be another indication. Somebody that wears a lot of sunblock would also be in that category. Osteoporosis, decaying of the bones as you grow older. There's other times other than age that can cause osteoporosis. There's certain drugs that can cause it. So if you put somebody on these drugs, say like corticosteroids is an example of one of those that can cause osteoporosis, you might want to supplement vitamin D and calcium in those patients. Or as a prevention, as you generally get older, you might be recommended to take vitamin D and or calcium. There's been a lot of studies by geriatric societies that say that you can prevent falls and fractures in the elderly if you provide vitamin D and calcium. I didn't mean to use the E word, but that is what is in the medical literature is elderly, and they define it as 65 or above. So I'm taking that directly from there. That is something that specific providers can recommend to their quote-unquote elderly patients. And some of the hot topics that might be discussed that people might see headlines on or what have you is things like cancer. Can micro or macro dosing vitamin D and or calcium help prevent cancer? Or depression, or something that's SAD, stands for seasonal affective disorder. That's something that Minnesotans might know a little bit more about since we're in the northern hemisphere than elsewhere. So those are two topics that I decided I would go a little bit further in depth in with vitamin D for you all. This is an official recommendation by a website called Dynamed, which is a place where physicians can frequently go to see what the current data shows on medication recommendations for certain disorders. And when it comes to cancer, they bother touching on this. And they say that vitamin D supplementation does not reduce the risk of invasive cancer in adults without a history of cancer or cardiovascular disease. And they call it level 1 evidence. So levels of evidence is something that's going to come up a little bit more in this talk too, because it is all, when it comes to medical recommendations, it's all data, amounts of studies, professional committees that come together to make these recommendations. And when you have level 1 evidence, that means that you have a randomized controlled trial most of the time that has a lot of patients. So they based this on the VITAL trial, which had over 25,000 patients in it. And that is surprisingly not even close to some of the largest randomized control studies that happen, but it's one where when you have that much data and that many patients involved, you have good demographics, good diversity in your patient population, you can make a recommendation that says this did in fact not reduce the risk of cancer in this population, so we can extrapolate that as a recommendation by the medical community. And I also said I was going to talk about depression. So this one gets a little bit more intricate and convoluted. So these are all level 2 recommendations, so they're not as definitive as previous. They don't have randomized controlled style studies that have more than 25,000 patients in them. Instead, they have smaller studies. The one I'll talk about down here is as small as 15 patients. So if you want your medical advice to be based off of what was found in 15 patients somewhere, it's still a study, it's still legitimate, still randomized, but the recommendations that we can make off of it are different than the larger. So level 2 evidence just says that these studies are smaller. Some of them are observational instead of randomized. So we looked at outcomes afterwards instead of intervening while the study was happening. So supplementation of vitamin D might reduce depressive symptoms in adults with depression. So if you have clinically diagnosed depression, there is some evidence that says that vitamin D supplementation might in fact reduce those symptoms, but then again, that's diagnosed. So all the patients that were included in these studies had depression in their electronic medical record, and that was how they determined that they could be in the studies that went to give that recommendation. And then depression score in overweight adults was another study. So depression score, the reason I have that bolded up there is because scores on depression charts or surveys don't always determine exactly what your symptoms are. So this is something in medicine we talk about a lot is, are we treating numbers, are we treating scores, are we treating patients? What are the symptoms you have, and what are the values that we have with tests? You know, if you're not symptomatic in something, we can give you vitamin D to reduce your depression score, but you might not notice that on a symptomatic level. You might not feel less depressed. Just something I wanted to point out. And it might not reduce depression symptoms in those that have low vitamin D levels, postmenopausal women, or elderly women. So they don't have official recommendations saying that if you're in this population to treat depression, we should give vitamin D. For postmenopausal women, again, low vitamin D levels and mental well-being in elderly women. And then seasonal affective disorder, I thought this one was just interesting for us northern Minnesotans. They had a small randomized trial of 15 patients, but it was a definitive trial, and they did decide that vitamin D supplementation with seasonal affective disorder, it benefited these patients, and they listed it in the site that I was using for the sources as a level 2 recommendation. So it's something that psychiatrists that are dealing with seasonal affective disorder might use. So next, we'll kind of step away from vitamin D and talk about B12 a little bit. I'll let Logan do an introduction here.
So vitamin B12 is one of the vitamins that we cannot make in our body. So we need to get it from external sources. And the external sources that we best get it from are our lean meats, dairy, liver, eggs, anything like that. And it's really important because our body can't make it in its own, that we get it so that it can produce things like red blood cells and then help make nerves and repair nerves. And so some symptoms of vitamin B12 deficiency might manifest with your red blood cells or with your nerves. So one of the things that can happen is with your red blood cells, they don't produce red blood cells correctly, so you get bigger than normal red blood cells. Kind of with iron, similar like iron deficiency, you get smaller than normal red blood cells. And as a result of that misshapen red blood cell, you can't carry the oxygen nearly as well. And so because of that, you get fatigued and you get what's called anemia. And so vitamin B12 can manifest itself as pernicious anemia. And so as a result of that, your physician may prescribe you a vitamin B12 supplement. Another thing that can happen is nervous system deterioration. So things like kind of feeling foggy, having some irritability, having signs of just early dementia, kind of forgetting things, as well as like physical symptoms like numbness and tingling in your arms and legs and stuff like that. And so that can also be the result of a low vitamin B12. And so who's at risk for vitamin B12 deficiency? Mostly, we're able to get enough vitamin B12 in our diets that we're not deficient. But those that are more likely to get it are again, the elderly, because they're not necessarily eating as many lean meats, vegetables, or lean meats and dairy and things like that. People that are vegans, so they're not eating those food sources at all because of their dietary restrictions. And people that have had gastric bypass surgery. Because in the process of having a gastric bypass surgery, they reroute your small intestine to your stomach to miss the part of your stomach and intestine that absorbs that vitamin B12. And so many times, people that have had gastric bypass surgery are put on a preemptive vitamin B12 dose.
So just kind of like I did for vitamin D, only this one's different because Logan talked about a couple instances where you have vitamin B12 deficiency, but when I researched for you guys in the medical literature when it says to give vitamin B, here we don't have prevention of osteoporosis, we don't have breastfeeding babies. This is literally the only one that they recommend is when the patient is deficient in vitamin B12, you should give them vitamin B12. And there's a lot of diseases that can lead to that, whether it's the gastric bypass, pernicious anemia, alcoholism. Those are all associated with deficiencies in vitamin B12, but they only recommend giving it when you know that they're deficient. But theoretical indications, because we understand the science behind vitamin B12, how it works in the body, things like this, you know that vegans are at risk of having less intake of this vitamin B12. So theoretically, should we give it to them? One thing that we know is that the liver actually stores vitamin B12 for anywhere from 2 to 10 years after you stop intaking it in your mouth. You can store it there. So, you know, and with all the fortified foods that there is now, a lot of vegans, you know, have almond milk or what have you that contains vitamin B12 in it because they know that vegans are going to be eating it. So they don't necessarily recommend that you give vegans vitamin B12, but theoretically you could come up with it and say, yeah, this could be one. Increasing energy, I put that there because all the energy drinks know that this stuff is used in production of your red blood cells and all of the mechanisms that it has in the body, and so they just load energy drinks with B vitamins saying that, you know, maybe this will increase your energy, but from what I could find, there's very little research around like patient-controlled studies that say, yes, this will, patients report that their energy is increased when they have these large amounts of B vitamins that are in our energy drinks. So, but of course the energy drinks are also loaded with caffeine and others. So vitamin B12, I had this from another presentation that I did in medical school where we grabbed some nature-made B vitamin supplements off the shelf in Walgreens, and we looked at the back and we're curious, how much vitamin B are we intaking when we have these supplements? And that vitamin B6 there has 6,700% of your daily value of your recommended B vitamin. Of your folic acid, also known as vitamin B9, that one was right at 100% of your daily recommended value. And that vitamin B12 capsule had 41,700% of your daily recommended value of vitamin B12. So that's where you start to wonder, are we starting to reach the upper limit by simply taking these B vitamins? Are we reaching the upper limit of what we would call toxicity? You know, your body has ways of getting rid of excessive vitamins, but you know, the FDA doesn't have to regulate this and say that when you intake this, are we worried about people that have nature-made B12 vitamin supplementation? Are they at risk of getting toxicity? The only way that we would find out is if this was reported to the FDA and in retrospect taken off the market. And I'm sure that not all vitamin B12 supplements are that high. This just happened to be the one we grabbed. So regarding this, vitamin B12 did make the press quite a bit. I think this was in 2015. These are all headlines regarding the same article. There was a research article that was published in the Journal of Clinical Oncology. They had a group of mostly older men from Washington that they had really good data on all of the vitamins. They called them the vital cohort, which I'll get to in the next slide. They had a lot of really good data that said, oh yeah, we took this much vitamin B every day and this much vitamin D, and they compiled all of their nutritional data in a nice set and all of their daily habits with their exercise and their smoking and their alcohol drinking, all of this. And one of the studies that they did on the vital cohort was, well, can we tie vitamin B intake with lung cancer? And they did. They found that, like this one just says, too much vitamin B6, B12 may triple the risk of lung cancer for smokers. And Logan and I will talk a little bit about if these headlines are warranted. So this is the original study that all of those headlines are quoting in the Journal of Clinical Oncology. The vital cohort, long-term supplementation of 1-carbon metabolism related to vitamin B use in relation to lung cancer risk in vitamins and lifestyle. So 1-carbon metabolism is just something we talk about in medicine where we know that B vitamins are involved in that. So they didn't they just didn't just want to say vitamin B intake. They wanted to make it fancy for you. But so they did a lot of correlational studies within this cohort. They said, well, if they smoke, if they don't smoke, is it related to if they, and they had quantities of increasing vitamin B intake, so you don't take a supplement at all and you probably don't get any from your diet. You do take a supplement and you get some from your diet, all the way to you take 4 supplements a day. They quantitized these people, put them in groups, and they found that the ones that did admit to intaking over 10 years, the use of 25 times the recommended daily allowance was associated with about a 4 times risk of lung cancer among male smokers. So this is a very, very specific thing. These are males, they are smokers. This is 10 years of use of a very large amount of vitamin B, but it was statistically significant. So all of those headlines, when they saw this finding, which was a small portion of this paper, I read this paper, it was one of the few findings that they had. Obviously 4 times risk is no joke, but that caught everybody's eye and it blew up in the headlines. But it didn't say in any of those headlines that these were male smokers, and then there was other groups that had increased risk as well. But what Logan and I wanted to talk about was this was actually a good study and warranted those headlines because, like I said, these are older males from mostly Washington, and you knew a little bit more about that study too.
Yeah, I wasn't a huge fan of this study, to be honest, because it had some holes in it. And one of the biggest holes was a correlational study. They did not show any causation. So they did not have vitamin B12 as the culprit behind lung cancer. And most of the lung cancer, if not all of the lung cancer that they found that vitamin B12 was associated with was smoking, which we do know causes lung cancer. And so there's not necessarily a strong tie in vitamin B12 and lung cancer for me in that respect. Also, this was affecting all men. They didn't find any association with women whatsoever. So women that also smoked and also took high levels of B12 did not have any increased risk of cancer. And so for me, and then the other thing, it was an observational study. So patients were actually reporting in the amount of vitamin B12 they were taking, and they're sending it to the people collecting the data, and that was over a 10-year period of time. And so that requires that person to know exactly how much vitamin B12 is in their supplement, as well as record that on a daily basis for 10 years and to be able to report that data. So that's kind of a reach because, as we kind of showed before, there's a wide variability in the vitamin B12 that is contained in supplements. So you really can't say for sure how much vitamin B12 they were actually ingesting or not. So for me, this study wasn't as good and headline breaking as a lot of news outlets maybe made it seem.
That being said, 10 years from now when I'm a physician recommending vitamin B intake, if I have a old male smoker that is taking these B vitamins 4 times a day, I might tell him to cool it a little bit, but at vitamin C, it's just a hot topic. I'll touch on this before I kind of hand it over to Logan here. So this is a water-soluble vitamin, essential for collagen formation in your body, and it's also a direct antioxidant. So you can put it in a test tube with oxidants and measure those, and if it's vitamin C, it has a direct antioxidant effect. So in addition to the collagen formation in your body, it's useful for that as well. Again, the only medical indication that I could find for you all was if somebody is deficient in vitamin C, which would be like scurvy that we may have heard about from sailors several hundred years ago, where they had no citrus fruit access. If you see somebody with symptoms of that, today it's like bleeding gums and strange things like this, replace their vitamin C so that they are no longer deficient. But the thing that I thought you all would be curious about is vitamin C for preventing and treating the common cold. This is a Cochrane review, which is a pretty well-established committee of scientists and physicians that make recommendations and take a lot of studies together. So when they did this, this one is from 2013, is the most recent one I could find for you, was they just looked at all of the studies. So there's a ton of people that look at this because it's a common question. And they interestingly found a cohort of people that were like marathon runners and extreme athletes that benefited from, because after their severe physical exercise, I'm guessing because they had so many radicals and oxidants, they benefited regarding their common cold symptoms from macro doses of vitamin C. They also found from this study that regular supplementation has been shown to reduce the duration of colds, so not supplementing when you get sick, but supplementing regularly so that when you do get sick, maybe it might reduce it. However, they made a statement that this was not always replicated, so it's a nice hand waving for you. And then this was their official recommendation at the end of the Cochrane review. I'll read it for you all. Given consistent effect of regular supplementation and/or the low cost and high safety profiles, this is the quote, it may be worthwhile for common cold patients to test on an individual basis whether therapeutic vitamin C is beneficial for them. But further therapeutic RCTs, meaning randomized controlled trials, are warranted. And this is the blanket statement that you will find after any scientific recommendation today, is we need more studies. But they actually said on an individual basis, go ahead and try it, because it might work for you and it might not. So that's what I have for you, and I'm going to let Logan talk a little bit about probiotics here.
So probiotics have kind of gained a lot of attention in the last few years because they're pretty readily available. They're found in a lot of things, but you know, there's really kind of differing opinions on what the definition of a probiotic is. And so in general, they're thought to be good bacteria. Probiotics are normally, the good bacteria are normally contained in our guts, and they help us to do a lot of different things. They have kind of like a mutualistic relationship with the body, and they help us out and we help them out. And so they're actual live organisms. And so to kind of get down to what defines a probiotic, there was a big group that got together, and this is an article that was actually published in Nature, and they wanted to kind of decipher down, okay, what actually defines a probiotic, because there's so many differing opinions out there. And so this was a group made up of a bunch of different doctors, family medicine docs, gastroenterologists, neurologists, pediatricians, geneticists, you name it. They were all a part of this. They all looked at a bunch of different studies on probiotics and their efficacy and things like that. And what they came down to decide was that probiotics are live microorganisms that, when administered in adequate amounts, benefit the host. So it's kind of a really wide blanket statement, but it does do some defining for us. So things that have like fermented foods, you'd think they're probiotic, right? Like beer and wine, right? They're fermented. It'd be great if they were, but they're not, because in the process, after the fermentation, those organisms are no longer live anymore. And so that's not a probiotic. Things like kimchi, sauerkraut, those could be considered probiotics, right? But in the process of canning sauerkraut, you heat that sauerkraut up and it kills all of those live organisms that were originally used to ferment them. So unless you're eating homemade sauerkraut, which hasn't been processed whatsoever, it's not containing those live organisms. Yogurt is a great example of a probiotic, and what they do is there's live cultures initially in the yogurt that in the milk that produces yogurt. It gets pasteurized, and then afterwards they add live cultures to that yogurt so that it can be a probiotic source. The other thing I was going to mention too is that a lot of information research has gone into with C. diff, people that get C. diff. There's actually such thing as a fecal transplant, which is curative for a lot of bad C. diff infections, and that they didn't consider probiotic because it's not. It's a live thing, but they didn't want to consider it under that probiotic umbrella, because who knows where that would have gone with industry, right? So what are probiotics supposed to do? Probiotics in general are supposed to help the immune system, and they're supposed to help the digestive system. And how do they do that? So this group looked at a variety of different probiotic organisms. The main ones they looked at were lactobacillus and bifidobacillus, and they found that the way in which they help us is they prevent colonization resistance. And so what that means is the good bacteria overrun the bad bacteria, and it prevents the bad bacteria from taking over. It increases the turnover of cells in the gut so that you're constantly replenishing those cells so you don't get the old cells that stay there. It increases the competitive exclusion of those bad bacteria, as we kind of just talked about. And that was widespread among a variety of different probiotics. As we move up this pyramid, there gets to be more specific things that they were finding with specific strains of probiotic. Some of the rare things that they found were improved neurologic effects, improved immunologic effects, improved endocrinologic effects. And those are really vague statements, and it's because they can't really tie truly this strain of probiotic causes this effect. It was just more like a correlational thing. But they did find general trends in that. So who do probiotics benefit? Probiotics benefit those that are currently taking an antibiotic. So antibiotics are good because they kill the bad bacteria, but in the process of killing the bad bacteria, they also kill good bacteria. And so probiotics taken with an antibiotic helps to maintain those good bacteria in your digestive system. It benefits people with constipation and diarrhea. So there have been really good studies that have shown that patients or people with constipation, probiotics, taking a daily probiotic has helped increase GI motility, so increasing everything and helping everything move through a lot smoother. They've also been shown to reduce acute infectious diarrhea in both kids and adults. So kids that have had viral gastroenteritis, when they were given a probiotic, had improved symptoms and shortened duration of diarrhea. And then that kind of draws me back to, again, the antibiotics. So one thing that can happen when you're on an antibiotic is a bad bacteria can take over, and that's Clostridium difficile, or C. diff, and that causes really bad things, especially in hospitalized patients. It's caused you to have really, really bad diarrhea, enough so that you're getting overly dehydrated and getting worse and worse, especially for those that are already critically ill in the hospital. Who else can probiotics help? Probiotics can help people with irritable bowel syndrome. There's been really good studies to show that probiotics help decrease the feeling of bloating and flatulence in those that take them regularly. So how much probiotic should I take, and what kind of probiotic should I take? So the best evidence has been shown with lactobacillus and bifidobacterium. Those are the two that have been studied the most and have found to have the best correlation with improved symptoms. And what do we need to do? We need to take live cultures of these. This is kind of discussed before. A lot of things will say probiotic in them, but if you don't look for the live cultures, you're not actually getting the benefit of that probiotic. And how much should I take? So 5 billion colony forming units is generally kind of a recommended dose, but most probiotics that you get off the shelf will contain way more than that. And so this is just kind of a label I pulled, and it has both lactobacillus and bifidobacterium, but many different species of those types of probiotic, and in very differing amounts. So like the bifidobacterium bifidum has like 84.5 billion colony forming units. And so it's got a way more than the recommended allowance. It's not necessarily a bad thing, but it just has a variety and a large amount, so you're probably getting an adequate enough amount when you take these supplements. So, a word to the wise. So many probiotic preparations are highly variable in the content. So that, as we just saw, there's many different species contained within that, and maybe many different activity levels of those live organisms. So there might be a discrepancy in dosage and frequency that you need to take those depending on what types of organisms are in there. There's currently no FDA-approved probiotics for preventing or treating a specific disease. And so that also ties into the fact that we can't always say that a specific probiotic will always have the same effect, because there's a bunch of different bacteria that are contained within, usually within a supplement. And for the most part, there's very little side effects in taking probiotics. They did have some studies that showed patients that are critically ill and in the hospital, probably not a good idea to add a probiotic in, but for most of the general healthy population, it's a great thing. But with the stipulation that you should take them with, if you're getting symptoms of IBS, or diarrhea, gastroenteritis, that kind of thing. So take-home points. Vitamins and supplements are regulated by the FDA differently than prescription drugs. And so this means that we really need to be conscientious about how we take these vitamins and supplements, and that the fact that they're regulated after the fact, not before the fact. They can't be in the same group or considered in the same group as the drugs that are prescribed. Recommendations for intake of supplements is often lacking sufficient data and or studies, as Jimmy and I talked about multiple times throughout this. Everything needs more study. But I think we can gain some pretty good insight into what there is out there and gain some pretty good footing on taking some of these supplements. And then the risk and benefits of supplements should be considered on an individual basis. Everybody's different, everybody has different needs, and depending on your dietary needs and or your current health state, different vitamins and supplements would be beneficial or potentially harmful.